So it's now 2 months since the wider opening of schools on the 8th of March, and we are still, fortunately, looking at quite good news. On this chart, we can see that the number of cases in the whole population has actually continued to decline. It's now, according to the Office of National Statistics, at a rate that last seen on the 2nd of September last year, that it's about 1 in 1,200 of the population currently have the coronavirus. We see the same pattern in all 4 nations of the UK and in all the regions. Continued declines, maybe a slight increase in Yorkshire Humber, but at low levels, quite hard to tell. When we look at school age groups, they have declined in the last weeks. So there was an increase after the opening on the 8th of March, but they have declined even since the end of the Easter holidays. When we compare with all the age groups, where now you can see the blue line here for primary age children is actually now at the lowest level that the ONS has ever recorded. It's 1 in 1,800 of the population. For secondary school students, year 7 to year 11, we're at the same level that we were at the 6th of September last year, 1 in 1,100, which is just marginally higher than the all-age average at 1 in 1,200. So these are good news figures. We need to keep them moving in the same direction. This chart has some concerns for us. This is looking at the different variants of coronavirus. Excluded from this chart is the Kent variant, which is the dominant variant in our country. But that purple line you can see, that's the South African variant. And the very sharply rising yellow line to the right-hand side, that is the Indian variant. The Indian variant has today been declared a variant of concern rather than a variant under investigation. So it's now going to be subject to surge testing. There is a concern, obviously, that some of these variants might be able to escape the vaccination. We're not sure that that's the case yet, but it's something we have to keep looking at. This chart shows the number of lateral flow tests completed. Now, we don't support the use of lateral flow tests as an alternative to isolation, although there is a proper study going on into that at the moment. We can look at that when the study returns its findings. But we do support the use of lateral flow tests as a general population test because they do find some positive cases. So this chart shows that on the 7th of March, in the week of the 7th of March, that's the week that schools opened, that a lot of these lateral flow tests were conducted. They were conducted mainly in secondary schools. The fact that the numbers are now lower than then is something that we don't welcome. We want parents to be conducting these tests on the regular weekly basis. They do find some positive cases, and that is good. It will help suppress the virus. There is this still continuing good news on hospitalisation and deaths in the next 4 slides. You can see here hospitalisations dropping away. That's on the normal scale. If you plot it on a log scale, on the left-hand side here, the y-axis, instead of going up arithmetically 1, 2, 3, 4, it's going up 1, 10, 100, 1,000, 10,000. That's the log scale. And on a log scale graph, a straight line is exponential. Straight line going up is exponential growth. A straight line going down is exponential decay. And this shows that hospitalizations are continuing to decline on this log scale graph. That's very good news. The same thing with deaths data. Obviously, every death is still a tragedy, but it is good news that they are still declining. And actually, this line is, if anything, getting a little bit steeper. And that's obviously for hospitalizations and deaths, the result of the vaccination being rolled out. So when you have the opportunity, do get vaccinated. The number of outbreaks in schools went up slightly more this week, and so there were 9 outbreaks in primary schools. That's 1 in 1,950 primary schools. There were 12 in secondary schools. That's 1 in 350, and 2 in special schools. That's 1 in 790 special schools had an outbreak. An outbreak or a cluster is 2 or more cases in the same institution. A attendance, the figures in primary schools are at 96%. That's essentially normal attendance. Secondary schools slightly below that at 90%, but much higher than they were during the autumn term. About 1% of those who were absent were because of coronavirus. And you can see there 3,000 because they had a confirmed case, 12,000 because they were suspected. The bigger number because they are self-isolating. The vast majority of those self-isolating do not have coronavirus, but we're asking them to self-isolate as a precautionary measure to try and stop the spread. Vaccinations are continuing to move out. You know that we're now on the 40-year-olds being vaccinated, and it will move down into age 30 in the 30s across the next couple of weeks. This is very good news. Congratulations to the NHS, to the vaccine scientists and the science teachers who taught those vaccine scientists. The R rate is still estimated by the scientists to be quite close to 1. But on this chart, you can see there is a concern that it might be over 1. It might not be, it might still be below 1, but it might be over 1 in London, the east of England, the southeast. So there is some chance that cases are starting to increase again. For that reason alone, we think mitigations in schools should be maintained. And so our advice to government was keep mask wearing until it's really clear what happens, till it's really clear what happens after May the 17th, till it's clear what's happened about the Indian variant, etc. We do think we should encourage the use of lateral flow to find asymptomatic cases. Ventilation really matters. In-person staff meetings really shouldn't be happening. We think clinically extremely vulnerable people should be home until they've had their second dose and built up antibodies to that. It's not just us that say this about masks. UNICEF and the World Health Organization recommend mask wearing for 12-year-olds and up. Obviously, that does depend on how many cases there are, but that is also advice from the WHO. As we open up, we will see that more people are going to work and not staying at home. And we reported on this last week. The numbers are getting larger as the opening up continues. And the big question is, what will the balance be between the spread, the competing pressures from the spread of vaccination and the ease of ventilation during the summer compared with the relaxations? And what we can see on this chart is that obviously everybody wants to be able to meet their friends and family. And over half of adults met up outdoors with someone outside their household since the freedom to do so came about. That's obviously, people really want to do that. The big question is, will that start to increase cases? And on this chart, we're reporting on something else. The question of unemployment is going to be a really big issue for young people. Unemployment for 18 to 24-year-olds is at 15%, for recent graduates at 12%, much higher than the general figures. And we think that we should be saying, that the government should be saying, that young people have borne the brunt of many of the restrictions, had missed university, had to be home from school, essentially to keep older people safe. We must not let that generation become another wasted generation of long-term unemployment like we had in the 1980s. We need huge investment in employment, apprenticeships and training. Part of that has to be in education recovery, and the very pitiful amounts of money that our government have so far allocated to education recovery, compared with much bigger figures in the Netherlands, in the United States, those low figures for England are frankly quite shameful. Let's hope the government can move on those. The NEU is continuing to maintain our school COVID map. You can look at the figures around your school, continuing to give health and safety advice on our website, and our education recovery advice. Thanks for being a member. Thanks for looking at this and sharing it. Thank you.